The final presentation will be from Goossens, who's from Biosense. He's at home here in Belgium. And he's going to talk about business, creating business values. And after that, we'll have a general discussion, and Yo will take part in that overall discussion. All yours.
Good afternoon, everyone. So, one could say after all that we've heard, is there anything more I can say that you haven't, or you would like to hear, or you haven't heard, or you're still unsure about? So, at least from my perspective, from Food for Me, what we've learned in that project, that is enormous. Now, we've only played a very small part, a very small role in the project, but our role was trying to combine some of the elements that the other groups did. I'm not going to explain all in detail how and what we managed to do, because of time, I simply need to stay relatively at the surface and give you, let's say, key takeaways from the work that we did. So, our work in Food for Me was actually business and value creation models for personalized nutrition. So, and it's an exceptional thing within the EU research project to have actually, while the research is being done, looking already at what the consequences could be in terms of business and societal impact of these things. So we try to do our very best and understand in this very complex world and very, let's say, very uncertain approaches that might be done, what we could learn from this and what messages we could actually give you to take away and to start looking yourself whether this is something you would like to do or whether this is something you say, stay away from this. So there will be positive messages, there will be negative messages in my talk, I can tell you. So basically what we aimed to do was to understand what is the essence of a personalized nutrition offering in terms of a business model. So what do you want to achieve with personalized nutrition? So what is the concept we want to implement? What are the barriers and opportunities if we want to do that? So what are we confronted with? And what are the kind of concepts that in the future might actually emerge if we think out of the blue what could happen? Now, some of these things, they all sound very typical business analysis wise, but for an area where you have very little hard clues on what's going to happen and how it's going to look like, this is not an easy thing to do. So, but the way we approached it was actually working with a wide range of stakeholders that we invited in several workshops. We did interesting discussions. So a lot of what you hear is actually, let's say, the joint impressions that we got from a wide range of people. So it's not just me telling what we have done. I'm just the voice for a number of opinions that we have collected. So one slide on the research process, the things which we've done. First thing was actually looking at what was in the marketplace. Out of this, we identified 9 archetypes of business models that you can find today. Well, 2 years ago, this was done. So today, you'll probably find even more. You find different. Some will be more present than others. So, but we have a view of what a business model would look like today. That's one thing. Not going to tell you about this because this is the past. We are talking about the future. So we then asked people, if you think about personalized nutrition and implementing it, what are the barriers and opportunities that you perceive? And we come, at some point, I'll tell you about this slide, 7 key issues or 8 key issues that we have identified, which are perceptions that are barriers for personalized nutrition uptake in society. Not necessarily to do with consumers. Out of all this, we started to distill what is a system of personalized nutrition offering. How does that system look like? What is happening in there and what is influencing it? So if you want to have a business model that operates a personalized nutrition offering, how does that operate? Not in terms of management and products and all that, but in terms of driving forces in your outside world and within your organization that you need to take care of. And then finally, if you think about business models for the future, what is the future? So what we needed to do was also have a brainstorming about what are the futures to be conceived in Europe to take, that will emerge if we take as a society responsibility about the nutrition and health issue. So we designed 4 scenarios in which we looked for what are the business model opportunities in those scenarios. We then added from the project consumer perspectives, the scientific basis or the knowledge that we had to the extent at that time available, because obviously we were working in parallel and the POP study was not finished while we were doing that, but we took some of these things in account to the extent possible. And then the technological opportunities, which Hani is not here with us, but she spoke about many of these things. And we built all of that together and created business and value creation models. Now, these business and value creation models, I can't tell you in detail about these because you have to describe them in full. But I can tell you what are the key takeaways for each of those, and which are general for all business models and relevant to understand. So, we are in an area. We live in a world. We have never known more about food than we know today. We have it very difficult to make the right choices. This is exactly the problem that we're talking about for personalized nutrition. And so what are we saying? The underlying system to make those choices is extremely complex. So, and if you doubt about the complexity and the fact that personalized nutrition might have a way of handling that complexity, I'll show you the system. Now, before doing that, the core of a system for personalized nutrition, it is about assisting individuals in achieving a lasting dietary behavior change. So that's what we aim to achieve with personalized nutrition. And that change obviously should contribute to health, right? So it's not changing to a full fat diet, it's changing to a diet that does something good for you. So the personalized nutrition system, we looked into that and we described that system in its various components. Now what you see here, I can't explain in detail. This is what we call a systems map, a systems dynamic description of what personalized nutrition is. Now what do you see at the center of that map? Okay, mine is slower than yours. At the center of that map, there are a number of activities, you know. It's about, I'll show you that in a different way. It's about giving nutritional advice, which leads to appropriate dietary patterns, which leads to an experience of well-being, so you achieve something that is good for you, and that adds to the propensity of taking more diagnostic advice and diagnostic feedback that actually confirms that you're doing good. And that actually also leads to your capability and your acceptance to more counseling, because you see something good happening, hence you want more counseling. So when you get more counseling, you get more nutritional advice. Now that, what you're seeing here that's a reinforcing loop, right? If you get this going, your business model will be working and actually people will be using your service. This is what you want to achieve. This is how we see a personalized nutrition system should operate. This is the core of every business model. Now, as you can see, that core sits in the middle of a variety of factors that are influencing it. Now, I can't explain all of this, but you could read this map in the way that each of those factors, for example, the prevalence of lifestyle-related diseases, influences another factor, namely the financial pressure on healthcare system. If one increases, the other one increases. So the blue arrow indicates a positive effect between those factors, right? So these are two driving forces sitting in that environment around personalized nutrition that influence it. And the arrow indicates the direction of influence. So that's the arrow. You have also red arrows in the map, which actually say they have a negative influence on the other variable. For example, if the fit of nutritional advice to personal food preferences, if that is high, actually the force of dietary habits, your inherent dietary behavior, will be countered because you have a good fit to do something different, and hence the force of dietary habits will reduce. So this is how you can read those things. And there is a complexity in there. Now, just to give you a feel for what it is, this map shows you the driving forces, and it describes the environment in which personalized nutrition is sitting. And if you look at it, you can actually see areas of influences. There is an area that has to do with the healthcare system. There's an area that has to do with the economies of our society and the work environment in which we are. There is an area about food production and food consumption, an area about individual psychology or the way how we internally deal with food and choices and food choices. There is an area about the scientific side and the diagnostic testing. So you can see all of these elements are feeding in some way into how a personalized nutrition offering can work. So this is how you can look into the system that is such an offering. Now, as you can see from that map, personalized nutrition is deeply rooted in the societal tissue. It has to do with economics, with healthcare, with food production, consumption, psychology, science, all these elements. So it's an enormously embedded activity in societal tissue. So that means if you want to set up a business model in this area, you will be facing societal issues, societal impact. You have to deal with that. You have to take that into account how to operate. So if you look at the map in a different way, there are certain variables that are more influenced by others. So these are pivoting variables, as we call them. They're really at a key point in that system. Now there are 8 in the system. So, and each of these variables, if they come there, each of these variables, they play a key role in activating that personalized nutrition mechanism, right? So you have financial pressure on the healthcare system. This is one, important. The effectiveness of economic feedback signals to the person, to the individual, to make his behavior appropriate in terms of nutrition and health. That economic signal is vital. The effectiveness, obviously, of the nutritional advice, the reliability of that science underlying that advice, the acceptance to do diagnostic testing, because you need to at least measure yourself to be able to get right advice. The psychological ambivalence in our heads, that is a key factor, of course, to make the right decision. So, but you need to handle that. The force of your dietary habits, that's what you actually try to change. And then the ability of the food industry to provide personalized or individualized food offerings. So these are 8 variables that are crucial. Now, not surprisingly, and actually the research was the other way around, but this was derived from what key stakeholders in the personalized nutrition area told us. So as well industrial as societal stakeholders, we asked them, if you think about personalized nutrition, what are for you key barriers? Now, it's top line points. Each of those, there are a number of arguments underneath. The first one was the doubt about the scientific evidence. Is the scientific evidence strong enough? And we've heard there is a lot of work that still needs to be done. But there is a lot of doubt. So be aware, if you set up a business model, there is a lot of things that still need to be done in this area. The next one was about diagnostics. We need to diagnose. At some point, we need to measure. Can they be done in a reliable way? Is it feasible to do some of these measurements? Are they cost effective or are they affordable to people? So there are many people raising questions about whether this actually can be done in a business model. So again, there are some answers. I think Hani has showed us thousands of opportunities to use tools for these things. The question is, to what extent will they be manageable for normal people? To what extent will they be linked up with systems, and so on and so on. The other thing is really individual advice possible? Now, within Food for Me, we have said probably the advice, the scientific basis for nutritional advice is going to be more on a metabolic group level. This is what we felt within Food for Me. And the individualization, I'll come to that later, happens at a higher level. It happens at the way and let's say the type of meal pattern advice that you give. This is where the individualization happens. Another aspect was really, how can we make personalized advice useful for people? People are not looking for advice. Our society is not actually interested in using food as a tool for health. This is not inherent in our behavior. Our systems, healthcare systems, is not designed to do all these things. So these are serious barriers. So in order to make sure that your advice is useful, we need to overcome many of these things. There are a lot of intrinsic barriers in society to accept personalized nutrition as an offering. The food industry, they said basically, this is not our world, It's not economically viable even to think about individualized foods. So go away. We are not going to do this. Maybe for some metabolic group levels, which are large enough, we may be able to do something special. But that's it. So they are not going to individualize products. Okay, we have 3D printing as maybe another option, and there are probably 10 other technologies that can address that. The question is, there is a lot of concern that these things are not feasible from a food industry point of view. Then the point of economic feedback. Many people have said us, If we don't have economic feedbacks in the system, it will not work. You'll have to dig into the pocket of the people in order to make them change. So is our society able to set up these systems? You know, who is actually handling, who is kind of the policy making in the healthcare sector? It's not the nutritional industry, yeah? It's not the food industry, it's not these type of people, you know. You're talking about the medical device people, about the pharmaceutical. This is a different world. They are implementing that. So this is a serious barrier if we want to get economic feedback signals that help our business models to drive. It's not going to be easy to get those. And finally, most importantly, we are talking in personalized nutrition about a change in dietary behavior. It's a behavior science thing. It's more than it's not hard science. It's about behavior. A lot to do with sociological aspects. So people are not looking for advice. People are not going out to seek that. People are not thinking about health in terms of food as a factor to improve health. So in order to get that change in behavior, you will need a lot of tools to convince people. So it's tough. So if I look at these barriers, and I'm in the industry, I would say, will I ever start with this, you know? But there are a lot of very good things that we need to think about in terms of personalized nutrition. Okay, I'll move on this for the sake of time. So we come to the definition of what we want to do as a personalized nutrition business model. It is, we want to recommend a dietary behavior that is appropriate for an individual to maintain health, and it takes into account dietary, lifestyle patterns, phenotypic, biomarker, and genetic background. All of these elements, they're not all compulsory needed to be there, but you need a number of these, and you recommend on food choice, on eating patterns, meal patterns, lifestyle, and physical activity aspects, all those things that relate to nutrition and health. That's what you need to do as a total service. Why do we need all of that? If you don't do all of that, you're going to have much less chance to achieve a dietary behavior change. Now, this has nothing to do with nutrigenomics. Nutrigenomics is the science. And many people think personalized nutrition is equal to nutrigenomics. It's not. So I just wanted to make sure with this slide you understand that. Now, one of the key things that we feel and that we understand from Food for Me is that the personalization, the individualization of the advice sits at 3 levels. There is this basic knowledge about nutrition, about the biomarkers, about the genetic background, and the interactions with the diet. And on the basis of that, we can formulate optimal nutrient requirements for a person. For a certain category of a combination of that, you have a certain optimal nutrient requirement that you can formulate. This is at the metabolic group level. You have many people who are very similar, so you can design that. Now, the first step of personalization happens really at the moment where you need to diagnose the person individually to make sure that you understand in which metabolic group level he is, right? To which group does he belong and what advice should he give? And on the basis of that, you can give a first basic set of advice in terms of nutrition to that person. That's the first step. The next step is actually to turn that advice into actionable meal patterns and let's say daily activities that people can do, right? It's what Sylvia talked about, is the meal patterns, preferably over a week, preferably for a whole family, things that are actionable within a societal context. So this is where the next step of individualization happens. But there's a third level on top of that. Is how? Does that person want it to have face-to-face or through the internet or on the phone or just through apps and through things, wearable devices? How do you want to do that? Also, there is personalization. Even as we discussed earlier today, is it a public healthcare thing or is it a company innovation thing that we need to do? Even that's a choice. And that choice the consumer must have, because that's what it's all about. It's about individualization, the choice for making the right decisions and for changing dietary behavior in the way you want it and in the, let's say, the process you want it. So these are 3 levels. Now, this is different than what we did in the past. But in terms of nutritional advice or dietary advice, there's not very much that changed, you know. We did recommend on a traditional way good dietary advice based on the food pyramid, and this is still valid. This is not, we don't throw all of this away. Over the years, what we've done, we've added a lot more biomarker elements in there. So we understand much more about the system, and we can improve the advice because of that. What we now do with personalized nutrition is two things. You add a genetic background to it, which reinforces the strength of the advice that you can give, and you add also different ways of offering that service, right? So you have a full personalized nutrition service which is actually going to be through very different channels, and it actually also adds more than just the nutritional advice. It gives you advice on what to cook today, what to buy tomorrow, and all these things. So it starts to integrate within daily life in a much more coherent way. So the essence of personalized nutrition, if I come back to that, it's not about giving more or different nutritional advice. We don't change the advice. We improve the quality on the basis on which it is based. It's not about commercializing nutrigenomics. This is not about genotyping and putting that into this environment to make money out of it. It's not about tailoring foods either. The food industry doesn't even want that. And it's not about making food your medicine. You're not actually putting food into a medical perspective either. So what it is assisting individuals in achieving a lasting dietary behavior change. And what you do is actually, it is about adjusting that nutritional advice with all the elements that we now have, which is more than we had in the past, recommending dietary patterns that fit individual preferences, and to coach the people to adopt that healthier lifestyle. All of these things is what you need to do in a personalized nutrition offering. So there's a lot of things to be done, isn't it? So we're actually talking about a constellation of activities in a business model. You need to collect personal information. You need to establish that risk-need profile for the person that you're going to advise. You're going to interface with that person in various ways to deliver that advice and to make sure that he follows up and understands and all this. And finally, you have a number of tools that make that advice actionable in daily life. So if you look at all of these, information collection, can't go into detail there, but there is as well things that you can do yourself. You can do through apps, you can do through questionnaires, you can do through face-to-face interaction. You have monitoring tools. All these elements come together in that block. You build a risk-benefit profile based on the science that we know of. You need algorithms, you need data to actually take the diagnosis from the person and verify what that means in terms of advice. You interface in various ways, right? Either through mobile tools or by phone, by internet, whatever. Many ways to do that. And you have all kinds of tools that will help you to action to make that advice actionable. Intelligent kitchens, shopping assistants, personal food delivery types of services. You could probably put 100 there already that today exist, that start to emerge already. So that constellation of activities. Now, if you think in terms of a business model, you can then see already hundreds of opportunities how to combine these activities. But then again, there are 6 other attributes that actually differentiate the offering that people can make. So to decide as a society to go for one or the other is going to be difficult because there's many choices. Who is organizing the personalized nutrition? Is it the government? Is it a private company? Is it an NGO, an association, a patient association, for example? Or is it a corporation that does it for its employees? All of this is possible. What data are you gathering in the service? Some might actually want a very simple kind of data. Some want to have the whole lot. How do you interact, right? Is it through the internet, email, phone, face-to-face, all of that? What feedback are you giving to the people? Are you giving them a full insight in their health status? Are you simply giving them an advice on their meal patterns? Or are you giving them a full lifestyle advice? What are you giving back? Again, choices to be made as a business model, many opportunities to make that very complex or very simple. How frequent are you going to give the feedback? How frequent is your interaction with the customer? So that again, or with the patient or with the employee or whoever uses the service. And finally, can you actually, after some advice, also track progress? So this is another element that you can add. So these are 6 key attributes along which you can actually diversify business models very interestingly. So there is room for many types of services. And this is exactly where the personalization can help people to choose exactly what they want. So we will need all these kinds of different offerings because people want to choose between that. And that makes the market a lot more stronger than saying, okay, this is what we want to do and this is it. No, I think you should actually see all of these things emerging, hopefully. So what we're talking about in terms of a business model is not so much a company that actually has all that knowledge and actually gives that advice straight to the consumer. What you'll probably see are that personalized nutrition offerings will be through an integrator type of a function. An integrator function that actually takes a number of these things, from medical appliance industry up to analytical laboratories for diagnosis, data handlers, information databases, app interface developers, all these people that offer tools that can be useful and data that can be useful for making the advice. And the integrator, okay, I'm showing qualified there as it is the spin-off from Food for Me that actually already is building a platform for the data service providers and for the knowledge rule developers, so that this service is available for anybody who would like to build a personalized nutrition advice. There should be a source that gives a basic, fundamental and scientifically validated basis to start from. And the integrator has as clients a whole panoplia of customers. So potentially the personalized nutrition service, the company, the integrator himself may offer it to the end user, but most likely all of these top players there are interested to incorporate some personalized nutrition services within their own services. Retailers, employers, schools, daycare centers for children, wellness, fitness centers, dietitian, nutrition, they're all, so we're talking more about a business-to-business model than even a business-to-consumer model. So, but none of them are actually capable of developing this and all of that, because they don't have the competences. So you're building that up in layers. This is how we think the business models will actually turn out to become useful. And it's the last group that actually interacts with the end user, with the consumer, or with, let's say, going back, with consumers, patients, employees, children, whoever it is. So a whole range of potential end users. So we then looked at the future. Now, how are these business models going to emerge? And we thought about a future which was kind of given in by two axes: the conception of health that a society has, whether it's more of a management issue versus what people feel, so it's more of a personal conviction type of thing, as against the logic of the healthcare systems, the way a society or a group of people are operating their healthcare system. Is it based on a purely economic perspective, or is it really based on quality of life perspectives? And within that area, you can design 4 different scenarios. Unfortunately, I have no time to talk about these scenarios in detail. There is a brochure which is available on the website. You can read through these, and you will see, if you read those 4 scenarios, you will see personalized nutrition almost popping up. It's not part of the scenarios, but you see it will be naturally fitting in these. So for each of those scenarios, we have, for each of those scenarios, we have developed a business model. And we have other business models that do not sit specifically in scenarios, but for each of the scenarios, we have Healthy Citizen, we have Google, we have Sun City Community, and we have WikiHealth. 4 descriptions of a business model that perfectly fit into those worlds, right? So I would love to tell you more about these, but unfortunately, this is impossible because you have to describe them in very, very many different ways. But it's interesting to see that if you look at each of these business models, that they do have an enormous relationship with the societal environment in which these are developing. So what we see is that if you would introduce a personalized nutrition concept in society, you will find that that actually influences the change of perception in society about food and health. You're going to impact on that, inevitably. This is what you can achieve by introducing personalized nutrition. If you talk about moral integrity of doing these things, well, this gives you a good reason for justifying that activity. There is a lot of good things that may happen as a result of that. But on the other hand, when we designed the business models in the 4 scenarios, we saw that within those 4 different worlds, we needed actually to have very different business models to be operational. So if society decides to do something different in terms of nutrition and health, and we need to because we can't afford to continue like we are, then this will then have an impact on this will open up for personalized nutrition concepts to emerge in those worlds. So this is what we actually can say. The common feature that we see for those 4 business models in the scenarios, it's not something like you put up a company and it's there and it runs. It's going to be more of a transition. There's going to be more players involved. It's going to be a networked structure. There's going to be distributed profits. So it's not one who will have the profit. You will need, as if you are an integrator, you need a lot of people around you. And they will be part of that same ecosystem. So the profits will anyway be distributed. So, and you will have people driving it, integrating it, and those will be the ones who are generating it, but they will only get part of the profit. You will have many others who will have to join you, so you will have to convince them to do that. It's going to be very community driven. So you'll have to make sure that your business model works within the community that you want to position it. You have to rely on the fact that it can be taken up by a community as a relevant tool. And what we think is that because of the societal impact, the business and the societal aspects need to come together, and most likely the chances are to do that within a public-private partnership. There are signs these days that these things are starting to emerge more and more and are becoming more and more important. So, not going to talk about the future stakeholders, simply about the fact that is this the right thing, is this possible to happen right now? Yes, we have a capability to do things, right? There is a need to do things in terms of health costs and relieving the burden that we have. And there is a desire of people to take individual control and have freedom of choice. These 3 things come together and they actually create the opportunity for personalized nutrition. This is how I see, this is how we saw as a group and with lots of other people what personalized nutrition would be. So this is our feel. Yes, there is a lot of opportunities, but there is still a lot of work to be done. But I think it's worthwhile going for. So thanks very much.